Hi Wally, you've been to Tanzania before. Karibu Arusha, karibu to Arusha Town Clinic. This is where the dental clinic of the Arusha Lutheran Medical Center is situated. And previously we were part of the town clinic, which was based here, while the main hospital was in Garamtoni. But now the outpatient services have moved to the main building, and we'll have more space in here, so that we could have at least 4 dental chairs, a small dental laboratory, and dental and oral x-ray services. Welcome.
Karibu.
So this is the reception area, and this is where patients come in, and they take the chairs up there. Here. Previously, when all the services here, it was ophthalmology, and we have some offices in the tea room on that side. So these were the doctor's room. We expect to get 2 more rooms on this end, so that we could have more chairs. One of the chairs will be used for oral hygienist who is in training now, and the other chair will be for an intern who will come from the University of Dar es Salaam and spend a year with us. And we also hope that after they spend a year with us and work in a church hospital, they'll be more willing to go into another hospital, because there's a big problem with the main power in Tanzania, whereby most of the people who are finishing their studies are not very much interested in doing the wet finger dentistry. The dental clinic is here. This is the dental clinic. We have 2 chairs. We have this one, which we got from Global Health Ministries 1.5 years ago, after the one which we had broke down. We have the autoclave, which we bought 2 months ago. We had a Prestige one which came through Global Health Ministries when the clinic was opened, and it failed because of power problems. And also our ultrasonic cleaner was there. It's now with a technician, but it had also a similar problem due to power problems, so we will come and ask for another one.
How is surge protection? Do you experience surges and shortages of voltage?
Yeah, we used to when the new hospital was not open, but now we have centralized the surge protection system. So at the moment we are in a very good shape. But previously we had a lot of problems because we are depending from TANESCO, and sometimes we had erratic power supply, which even the surge protection system used to fail at times.
And I see you have outlets. So you have the North American outlet.
Yeah, we have 2 outlets: the North American for 110, and also the normal one for 220 for our. And all that is centralized for the clinic, so that even like this chair uses 110, and it came with a transformer which we are not using, but we donated it to the X-ray department because they have an X-ray machine which uses 110.
That is great.
Yeah, it was very good, because even though we didn't need to use it, but then it was used by another instrument which was donated by Global Ministry. And this is the X-rays. There we have 1 X-ray, and this is also side protected. And this we have 1.
And how is your water supply to the dental units?
The main hospital has a borehole, and the borehole is located at the other side of the hospital, and we have a central water supply for the hospital and the clinic. But then the water has a lot of issues with a lot of minerals. We have to put some filters outside so that we get water which is clean and with less amount of minerals. But the problem is some of these minerals, like fluoride, which is a big problem along the Rift Valley, cannot be removed with these filters.
Yeah.
So but the water is safe for most of the instruments which you use. But for the autoclave, we have to buy
distilled water.
Yeah, we have to buy distilled water from town.
Mm-hmm.
And we are using only one supplier who also provides distilled water to the car batteries and things like those. And the water gets tested before we use it.
That is good.
Yeah. This is the second chair. This was bought new. And this is the...
In country here?
No, from America.
Oh.
Nadek.
Oh, very nice.
It was delivered through a supplier from South Africa. It's not... it's very expensive. It's probably not what we'll acquire for the running of the clinic. And we have an automatic X-ray developer.
Very
but
nice.
then we have a lot of problem with getting supplies for fix and developers. And when we get them from different companies, we don't always get the same results with the films. And most of the time we end up not using it, but developing them manually at the X-ray room on the other side. Here we mostly see, we are two dentists, both of us trained at Muhimbili, but Emil has a second degree from South Africa in restorative and prosthetic work. And he went there because we want to open a small dental lab for the removable prosthetics and also for the crowns, because there's a demand in Arusha. And Arusha is a town where there's a group of people who can pay for these services, and we want to open that so that we can have them get the services here and pay a lot more amount of money which they are willing to pay, so that we can subsidize the other services. At the moment we don't have what we could call the outreach services, where we go to rural areas and treat people at a smaller fee, but we try as much as possible to lower the fees for those people who are in need, and especially children. Like for example, the glass enoma filling here will cost something like $1 to $2, which is very cheap, but then we can do that because we charge more for the people who need other types of filling, like the cosmetic fillings for the anterior mucosal fluorosis.
And the National Health Insurance Fund, that does not apply? Or does that?
The National Health Insurance Fund has limitations because it covers only for dental, it covers mostly the emergent services like the extraction and very simple fillings, which they also charge very cheaply. But we also have other insurance schemes which provide us with a lot more leverage. Like there's one called AAR, which they allow in 1 year for someone to spend close to $200 a year, and then we can charge them at a higher rate so that we could subsidize our services.
That is good.
Yeah, that's good.